Well, welcome everyone, and I'm so glad you joined into our second Wednesday speaker series. Today, we're going to be discussing the mid-session legislative update and giving you an introduction to Healthcare for All Washington and what we do. First, though, I'm going to do the land acknowledgement, which is I'm participating in this Zoom meeting tonight from the lands of the Coast Salish people. Please take a minute to acknowledge peoples in the lands where you are joining us from today. We acknowledge all of the ancestral homelands and traditional territories of Indigenous peoples who have been here since time immemorial. And as we walk the pathway to universal healthcare using the teaching of the leaders of Indigenous peoples to remember the lessons of life and to preserve our lands. We thank the Coast Salish peoples, the land which touches the shared waters of all tribes and bands within the Duwamish, Muckleshoot, Puyallup, Suquamish, and Tulalip nations. This meeting is being recorded and it will be shared on our YouTube channel in the coming days. So we want to begin. Usually we begin with a speaker, but this time we want to concentrate on getting to know you, people that are here in the room, Zoom room. So what we're going to do is go around the room and ask people to introduce themselves briefly by giving their name, which is their name, where they're joining us from, and what brought them here today, and what is their passion for healthcare, single payer healthcare. We presume that is your passion. So one of your passions. So I'll just call on people, and I'll start with myself. My name is Marcia Stedman. I'm joining from Bothell, Washington, and I have always felt that life needed to be fair. And so when we saw the Obamacare people, senators and congressmen, not listening to the single payer advocates and escorting them from the room back in 2010, I said, this has to change. We need to work on this. And maybe there's a single payer organization in the state of Washington. Lo and behold, there was Healthcare for All Washington. So here I am. Let's see, I have Annalisa up next. Annalisa, would you like to unmute and let us know who you are, where you're from?
Hi, Annalisa from Shoreline. Joining because I grew up with a mother who was a kidney transplant patient and saw firsthand the struggle getting health care and paying for it. And I think it's an important right for everyone.
Thank you, Annalisa, and welcome. Lynette and Denny, too. Are you ready?
Yeah, I think, can you hear me?
Sure. Yes, we
Good.
can.
Okay, I'll start off and well, I'm a registered nurse here in Spokane and retired. And after working in the industry, it came to my attention that so many people were denied health care due to their insurance companies. So I've been working on this for the last 20 years. And then my husband, Denny.
Yeah, I'm Denny Delwell, retired lawyer, previous legislator, previous chairman of the healthcare committee, and we had worked on healthcare reform back then, some time ago, and I wanted to continue to work, and I'm a member of the Healthcare for All Washington on the board of directors and policy committee, and I'm welcome everybody.
Thank you. Carol, please unmute.
I am a participant of Mid-Valley Healthcare Advocates in Oregon, in Corvallis, Oregon, and I'm a member of our legislative committee.
Great. Have you here. Ronnie.
I'm Ronnie Shore, a retired pharmacist. Been involved in public health and mental health and substance use disorders for my entire career as a pharmacist. And when I retired, I became involved volunteering to move things forward. I'm in Seattle, Washington.
Thank you, Ronnie. Ron, will you unmute?
Hi, I'm Ron Lovell, and been involved in healthcare for a long time. Once at Eastern Virginia Medical School, um, since I came to Washington 4 years ago, I hooked up with my old friend Ronnie Shure and found Healthcare for All Washington. I'm a great consumer of healthcare, twice a cancer patient and still surviving, and still fighting the insurance companies.
God. Sydney, would you like to speak next?
Sure. Hello, I'm Sydney. I'm the communications specialist for Healthcare for All Washington, and I've been involved with the organization since 2017. And universal healthcare is important to me because I grew up with great healthcare, but have been around people who were always stressing about affording their own healthcare, and just seeing the difference in access is okay. It seems criminal to me, so here I am.
Great. We're glad you're here. Mohit.
Thanks, Marcia. Hi, everyone. My name is Mohit Nair. I am very, very passionate about public health. It's kind of what my background is in, and I've always been passionate about universal healthcare. Having grown up outside of the US, I've kind of seen both ends of the spectrum of kind of extreme lack of access and also just the ways in which health systems can meet people's needs. And when I moved to the US, I thought it would be very different than it actually is. So it's kind of just been woefully inadequate, and I really want to help make it better. So that's why I decided to volunteer with Healthcare for All Washington.
Great. Roger.
Thanks, Marcia. My name is Roger Gantz. I'm, of course, a member of Healthcare for All Washington and a member of the policy committee for Healthcare for All Washington. In my former life, I worked in our state's Medicaid program as the policy director for our Medicaid program. And I'm currently a member on the Universal Healthcare Commission's Financial Technical Advisory Committee. FTAC is the acronym. And as all our members have been, I've been committed to healthcare reform, healthcare efforts throughout my professional life.
Great. David McClanahan, welcome.
Thanks. I'm a retired surgeon in West Seattle. I don't know if I'm the oldest guy here, but pretty close to it. I've been working in healthcare justice since the late 60s, early 70s in Staten Island, New York, where I was part of a group there that did that sort of thing. Came to Seattle in 1980 to work at Pacific Medical Clinic and have always worked in the public sector, volunteered at Country Doctor and International District Clinic. And 2005, we started Physicians for a National Health Program, Washington chapter, after a trip to Cuba and seeing what a great healthcare system they had. So since retirement, I'm the coordinator of PNHP Washington, and it takes a whole lot of time, except when I have to start. I've been using the healthcare that I avoided up until my 80s.
Thank you, David. Sherry Barrett. Oh, you're on mute. I guess you'll need to unmute if you can.
Hi.
I was calling on Sherry Barrett.
Okay, I am.
There we go.
I'm a retired physical medicine and rehab doctor living in Olympia, Washington. And my passion is I think that everybody should get equitable health care. That is, when people need health care, they can get it, and that we don't get unnecessary things because they're profitable. So
thank you. Thank you.
And we always talk about the indigenous people here. I've been a doctor for the Squaxin and the Nisqually, as was my father, a pediatrician. And my favorite thing about treating them is that the tribes pay for everything, and you never discuss finances with the patient. You just take care of them, which is a joy. So
it's good to be reminded of the Indian
health
system. Yes. Thank you, Sherry. Marguerite, good to see you.
I'm Marguerite, and I'm a member of North Seattle Progressives, and I am involved in our Health and Wellness Committee. And I'm a retired nurse. and I wanted to get the legislative update this evening.
Great, welcome. Jenny Von Rees. Can you unmute? Or maybe we can unmute you.
I'm a retired biology professor, and my daughter married a Finn, and so I've spent some time in Finland where the government is actually for the people, and it's so shocking to see how our country compares to them in healthcare, education, and happiness of the people, and care of the environment. So, yeah, this is part of it, what you're working on, and I'm so proud to be in Washington State where you guys are all working on it.
Yes, thank you, Jenny, for joining us. Sala, would you? Oh, I don't see you in your chair. Maybe you're there. You could want to join for a few minutes here. Tell us about yourself.
I'm not really a healthcare professional. I just wanted to get an update on what legislation was happening here. But I've actually worked in healthcare in Ghana, and malaria and other kinds, and supporting College of Integrative Medicine, which integrates their herbal medicine with Western medicine. So I don't know as much about medicine as everybody sitting here, but I just wanted to know what was going on in our state.
Welcome. Maria.
Good evening. My name is Maria Wesley. In a previous life, I have a background in public health, and I wanted to return to this now that I'm retired, and obviously, like everyone else, are feeling that this is a really important topic and want to see it go forward in our state.
Thank you. Sherry Weinberg.
Hi. Well, I'm a retired pediatrician, and I've been a long time advocate for single payer healthcare in the United States, or maybe we could be the Saskatchewan of the United States here in Washington State. Why Saskatchewan? They were the first province to put in universal hospital coverage in 1947. Can you believe it's been that long and we're not there yet? But we keep trying.
Good. Ted Weinberg.
Hi. Ted Weinberg, I'm the son of Sherry Weinberg. My day job is working at the Information Technology Department at the City of Seattle, where I'm an IT manager. In the nights and weekends, I'm a city council member here on Mercer Island, entering my second term there. And I've been spending a lot of the last month in Olympia, testifying for bills, and watching the process and learning the process as we go through. One of the things I want to help bring about in my lifetime is a universal single payer healthcare system. I realize that's not going to happen overnight. It's something that is going to take years, possibly decades. But I think we can build it one piece at a time and eventually get there. And so I'm eager to continue attending these meetings and learn what I can from what has been done so far and what I can do to help.
Yes, thank you.
Mm-hmm.
Heather Beecher. Would you like to unmute?
Hi, I'm a retired family physician and I still volunteer at the Free Clinic of Southwest Washington, not very competently anymore, but we do our best for the folks who don't have any other access. And although it used to be mostly undocumented people, they're more afraid to come in now, and we're actually seeing a lot more citizens who have lost access to healthcare lately. Thanks. And I'm going to Faith Action Network Day of tomorrow in Olympia to testify with folks for different bills with the legislature. Thanks.
Great, welcome. Jess Weber, would you like to unmute and tell us a bit about yourself?
Hi there, my name is Jess Weber. I'm a licensed veterinary technician. I work in an emergency hospital. I have been recently working with Fair Vote Washington for ranked choice voting and started following Healthcare for All more recently, so I'd love to help.
Great, thank you. Linda. Oh, you need to unmute if you can.
I have. Can you hear me? Hopefully.
My name
Yes.
is Linda Wang, and I live in Seattle. And I, for a while, work in with lower limb prosthetic people with lower limb prostheses, and research on that. And got some contact and heard stories of healthcare provided by the governments in British in England and Canada throughout my life, and have experienced my own need for a fair amount of health, quite a bit of healthcare, and appreciated being able to do that. But learned through all that everyone should, be able to get healthcare. That's just a right of people, humanity, and really important. And and I want to hear how things are progressing. Yeah.
Great, thank you. I think, okay, so Linda Moran, I must have skipped you. I'm sorry.
Oh, no, that's okay. It's funny because I didn't know there was another Linda on. I'm Linda Moran. I'm in Tacoma, and I'm a retired assistant attorney general. And my relationship to good healthcare goes back to when I was a kid. My dad was a public school teacher, and my mother had pretty serious mental illness issues. So she was in and out of the hospital a good part of my early life. And having good health insurance is what helped her be well and be in our lives. So as my life went on, I went to law school. And after becoming a lawyer, I knew that I was definitely going to be an advocate for women's issues because Roe versus Wade had happened when I was in junior high. So then I go to work in the Attorney General's, and my first clients were all of the professional health licensing boards. So I got to represent the Nursing Commission, the the Physical Therapy Board. And then we go forward, and I had to leave work because I got multiple sclerosis and began to have my whole relationship with a wide variety of healthcare professionals.
And thank you so much. We're going to move along because we only have a few minutes left.
So, Marcia, do you want to ask people to put a note in?
Yes. Put a note in chat. The rest of the people that I can't get to right now, I apologize for that. And I welcome you all here. And so we're going to move along to our next segment, which is the legislative update, I believe. Or no, yes, the pathway bill. Ronnie.
Yes. So Sydney is going to add the link for this document into our chat, so you can find it there. And please go to the chat to enter questions. Mohit will be leading a Q&A at the end of this presentation. So enter your questions there, as well as some introductory statements. I see Dr. Lee has already entered things, so please follow him and enter your information. So I'm going to spend a few minutes talking about this pathway document. We don't like to brag, but we like to explain where we came from and where we're going. So if you, Sydney is going to add the link for this that's in our website or on our website, so you can find the actual description or the longer description. But basically, we're despite David McClanahan's claiming to be the oldest person here, we are the oldest grassroots organization that's been working in our state, within our state. We started as a Washington Single Payer Network, but transitioned to a couple of different names. And we, in 2002, we renamed ourselves, or just chose the name of Healthcare for All Washington, and we created a message bill, the Washington Health Security Trust, a bill to create a single payer system in our state. We worked on that bill till 2018, and we got support. There were certainly people that once you put out a message, you do get a response. And we still have groups in our state, in our coalition, who are doing that. So we started with that Washington Healthcare Security Trust, but we shifted in 2019 as we learned there are some specific pathways that we could do through a budget proviso, eventually a bill that started with a work group and created this universal healthcare commission. We have been following that commission and have been working to look at some of the issues that will make our healthcare system feasible. It certainly involves federal support. It certainly involves changes in our state. It certainly involves our employers and our unions and all the people of the state to work together. Our theme has become everybody in, nobody out. And we have been really successful in creating and moving along to this commission, despite the barriers that you know are going to arrive. We haven't reached an endpoint, and we still have a lot of work to do. This year, because of federal cutbacks, we are focusing on saving the safety net, working with groups from public health to reproductive care, and still looking at the social determinants of health. We know that just having a healthcare system won't make everybody healthy. It's a support. And we are looking at ways to save money, to consolidate our current healthcare system, to increase availability and access, and to provide equity. So please take some time and look at this link that Sydney has put into your chat, and you can find some of those details there. Certainly while you're on that website, be aware that you can volunteer. You can look at the different icons at the top of the screen and move into our system. We would love to have you aboard. But let me hand you back to Marcia to introduce the next part.
Thank you, Ronnie. That was a really good, quick overview. Appreciate it. So next we want to hear from Roger Gantz, who's going to tell us all about the current legislative environment and what's going on in Olympia. Look, Roger.
Good evening. Marcia, can you hear me okay?
Yes.
Okay, sorry.
Perfect. Thank you.
Good evening, folks. As Ronnie outlined, our strategy over these last several years in Healthcare for All Washington has really been, especially in the legislative arena, is to work and support the work of the Universal Healthcare Commission. The other area of our legislative efforts has been in the area of looking at opportunities for transitional solutions, ways in which we can move forward health reform in an incremental basis. Next slide, please. Yeah, thank you. This session has posed some very interesting challenges for us. And that is that, as you are keenly aware, our state has been facing, as have other states, some unprecedented fiscal constraints with respect to funding for legislative objectives. So therefore, much of our work, and I'll talk a bit about that, has been focusing on the area of supporting revenue options for the legislature, and again, finding some key areas of bills that we can help support to move the legislation forward. In addition, one of our areas of concern has been to protect the work that we've been, able to do in the past. And one of those areas has been an effort to continue the work of the Universal Healthcare Commission. We were instrumental for this biennium of getting money to support the commission to the tune of $514,000, and working with the Office of Insurance Commissioner of bringing forward to support that effort $250,000 of their funds to work with the commission. We're pleased to find that in the governor's request legislation, that's Senate Bill 5998 and House Bill 2289, that funding is continued in the governor's budget. Another area that we have worked on in the past, which is critical, is being able to achieve proviso funding of $1 million to direct the healthcare exchange to begin designing what we call an auto enrollment system for people losing Medicaid coverage. This system would allow for people to be, if they're leaving the Medicaid program, to be automatically enrolled or auto enrolled in the health benefit exchange to ensure that they have continuation of coverage. I will add that HR 1, the federal legislation, is going to make this need all the more challenging with the changes that we are be seeing in the next couple of years with Medicaid eligibility. Next slide, please. What I'd like to talk about now are what we often refer to in our area, Tier 2 bills. These are bills in areas where we place high priority in working with the legislature in supporting existing legislative work that they've been engaged in. This year, we're in our Tier 2 level. We have 5 revenue bills, which I'll talk a bit about shortly, and 7 what I'm titling policy bills that we think will help, again, support our healthcare reform efforts. So let me go through these, if I might, briefly. One of these bills is Senate Bill 2382 that you can see. This is a increase in the tobacco tax by $2 a pack. And the funding for that, among other things, will go to support the Department of Health efforts to increase their emergency response systems, and also to support other public health efforts. Another bill is House Bill 2487. This is some legislation that actually will close a loophole to be able to employ the insurance premium taxes on all qualified entities. As I go through this, you'll see a reference to prime sponsor in red, in yellow, and then referred to Rules to Committee or wherever. These reflect where these bills are as of yesterday evening. As you may know, we're in quite a dynamic period right now as the legislature and the House and Senate rush to move and get bills out of their houses of origin. So over the next several days, the status of the bills I'm talking about now in the future will be changing. And as that occurs, we'll be sending alerts out to our members and others to continue to support these bills. Another bill that would bring forth revenue is Senate Bill 6173. This is kind of an interesting bill. We're quite aware that a number of employers have their employees obtaining Medicaid coverage. So what this bill would do is for those individuals who have those employers of 100 or more employees, these are large employers, who have workers who are themselves getting their health coverage through our state's Medicaid program, we would collect a fee from those businesses. Those monies would go into an account that would be used to help provide support for low-income persons and effort. And again, this bill is designed not to place a burden on small businesses, but on larger firms. There's also Senate Bill 6182, which establishes the abortion savings program. And this effort is to provide grants through the Department of Health and others to help sustain and support our state's commitment to providing services, abortion services for our residents. Next one, please. Perhaps the bill that has gained the most interest publicly has been something referred to as the Washington Millionaire Tax. This would establish a tax, if you will, on individuals, households with incomes over $1 million a year. The tax would be approximately 9.9%. And the revenue from that fund would go to getting to support K through 12 healthcare, higher education, etc. This bill, while we think it has sound policy structures to it, is one that is going to take a couple years to be implemented. So for our immediate needs, this bill will not be effective, at least in terms of revenue, for the legislature until approximately 2 years from now. So next series of bills I'd like to briefly talk about are what I'm calling policy bills. And what we've done here is list the bills in numeric order. It doesn't necessarily represent the priority of the bills for us. These are all what we call Tier 2 high priority bills that we are actively supporting. The first one is House Bill 2105. It's concerning immigrant worker protections. And as you can see from the screen, the bill is really designed to help protect individuals who do not have full citizenship coverage for being able to sustain their ability to work in our state and be provided the necessary due process requirements that we think are entitled to all residents and citizens of our state. The bill right now is in executive actions being taken in the House Appropriations, or it had been taken, and it's now in House Rules. From there, it will go to the full House for a vote. Next bill, please. Next bill is House Bill 2283. This establishes a medical loss ratio of at least 90% for health plans. What this essentially means is that for every dollar that a health carrier receives for providing coverage to enrolled members in their plan, 90% of that amount has to go for direct payments for services. No more than 10% of that amount can go for the administration of the program. If amounts exceed that ceiling of, that floor of 90%, the health carrier would be required to reimburse that back to individuals who receive coverage from them. House Bill 2548 requests legislation from our Attorney General. It's new legislation that came out late in being introduced. And what it does is provide their office, the Office of the Attorney General, to be able to review mergers and acquisitions in the medical area. This gives them expanded authority to review and process to be sure that these mergers and acquisitions comport with state law. Next bill, please. Next bill is one that we've been actively supporting. It's Senate Bill 5387. It's concerning the corporate practice of healthcare. Basically, this bill is in a response to the mergers and acquisitions that we've been seeing in our state, in particular through private equity firms who are buying practices and to some degree hospitals. And what this legislation seeks to do is to limit the ownership aspects in the administration of these practices to maintain the medical decision making within health practitioners. It's a bill that's been sponsored by Senator Robinson. It's passed out of the Senate Ways and Means Committee. It's referred to the Senate Rules and will be heard next week on the floor. We think this bill will really help our efforts to try to, if you will, mitigate to a degree the consolidation of healthcare, both vertically and horizontally, that we're seeing in our state and as well as nationally. Another bill is Senate Bill 5967. And this bill seeks to protect the preventive medical services, immunizations in particular, in our state. As you know, there's been efforts at the federal level to minimize and place limitations on immunization for children and adults. What that legislation would do is give authority for the Department of Health to issue immunization guidelines, and those guidelines would have to be honored by both public and private health carriers and others in terms of ensuring that individuals have access to the full array of immunization services. There is a Senate Bill 5981. Its companion is House Bill 2145. This legislation is anticipatory legislation dealing with what we call 340B drug pricing. These are discount pricing that's made available to entities such as public health departments, qualified healthcare facilities, public hospitals, to be able to provide low-cost drugs for individuals through their 340B program. And what this legislation would do is to allow for or prohibit manufacturers from restricting who would get access, of these critical providers are getting access to 340B pricing.
Thank you, Roger. I think you're out of time. Sorry.
Sure.
But there are a couple more bills, and
we got to talk about them later. Should we have time?
That's great, because Ron wants to talk about how people can advocate for these bills you've brought to us. So Ron, Lovell.
Thanks, Roger.
Thank you, Roger. I would challenge any one of us to remember all the stuff that Roger just talked about. It represents a lot of good information, but the lawmaking process in every state, including Washington, is like making sausage. It's hard. What we do is give you a way with the Take Action Network to amplify your single voice, so we all come together with your legislative dashboard. We connect you to the key bills just at the time when they're being heard by the committee, and their focused strategic advocacy often decides which bills live or die. Next slide, please. I want to give you and think about TAN as a way to vote every day in the legislative session. When you sign up and with Healthcare for All Washington, you get targeted alerts when those bills appear before committees, when they're being decided by the Finance Committee or by the Rules Committee. And then remember, too, that we're halfway through the session now. All the bills that pass the House have to go through the Senate. All the bills that pass the House have to go through the Senate, have to go through the House. So, and we give you one-click tools that let you send pre-formatted emails or voice your opinion to support or be against the bill. What it would do is turn your individual message into a chorus, not just a whisper. Next slide, please. And it's really easy to do it. What's important is timing is everything. They're most persuasive. The legislators listen when they are having to make a choice about what am I going to say about this bill. And our voices coming in multiple times encourages them to move in our desired direction. Next slide, please. It's easy to do. Your step, so you can vote every day during the legislative session, is sign up for TAN. It's easy. Go to our website, healthcareforallwashington.org/TAN. The session is moving right now, so we need you to come on and join us in the fight. Thank you very much.
Thank you, Ron. Excellent overview for your advocacy too. So next we're going to hear from you, participants here. We're going to have a Q&A, and if you had put questions in chat, Mohit will look through them, or if there are no questions, Mohit, will you take the stage?
Yes. Hi, everyone. I do see one question in the chat from Beata. It's a terminology question, not silly at all. Is the health benefit exchange the same thing as the Washington Health Plan Finder site? Marcia or others, if you want to clarify that quickly.
It is. You go to the Washington Health Plan Finder, and that's where the plans are listed, and you can compare them.
Yeah, one is the agency, one is like the storefront, if you think of where you go to find the plans. So it's a great question, though. For other folks, please, there's no such thing as a silly question at all. I have a bunch myself. So if you have a question, feel free to raise your hand and I'll call on folks. If you feel more comfortable putting it in the chat, I can take questions that way as well. Would love to hear from folks. What's on your mind? Roger, see your hand is up.
Yeah. Can you hear me?
Yes, we can hear you.
Just as a bit of a reminder, two things, if I might, on the legislative front. One is Healthcare for All Washington has a lobbyist, Lonnie Johns Brown, who is our lobbyist, who is a real firebrand and is working, as she is right now, in the Senate Ways and Means Committee, listening to critical bills for us and advising us as the legislative process works on. One other thing I would add, we went through these bills very, very quickly this evening. Are we okay? Very, very quickly this evening. And should you want more information, a great place to go is also the legislative website, where you can put in the name of a bill number, and it'll bring you to that bill, and that's bill site location. And there's something called a bill report. And this is prepared by staff for the legislators and for the public. They're usually 2 or 3 pages and no more. They give a good background on the bill and what the bill specifically is attempting to do. So it's a great educational piece for all of us.
Thanks, Roger. Appreciate it. I see a couple questions have come in the chat. Let's take Marguerite's question. What are the considerations of pro versus con on SB 5947, creating another commission for working towards universal healthcare? What is your position? Roger or others, do you want to take that?
I'll take that.
Okay, Ronnie, great.
So message bills are so important, and the work that groups like Whole Washington have done with Senator Hasagawa to get a message bill out there are really important to remind our legislators and the general public that there is a gold standard in mind. Unfortunately, the bill misses a few points that need to be added. We may see amendments as it works its way through the legislature. And the work that we've done, I think I mentioned that we transitioned to support this Universal Healthcare Commission. And while it hasn't completed its task, we have gotten that started. And I think that Bob Hasagawa's bill will be amended to include that commission. We're hoping for that, or see that as the future. Message bills are a way to activate the community. They're a way to alert legislators. And the stand or the position that Healthcare for All has taken is to really move forward and keep pushing this Universal Healthcare Commission that was a message bill that we were a part of back in 2019. So 5947 is probably going to have a number of amendments. It is hopefully will raise legislators' awareness that we do need to keep that effort going in our state. Commission has legislators that are members of that Universal Healthcare Commission, so it's exciting to see active members participating in that. And bills are important. There's no question about that. They have multiple roles, but there are non-legislative actions like supporting that commission or pushing the commission. We have a healthcare cost transparency board in our state that is trying to control costs. We have a prescription drug affordability board that is looking at upper payment limits. And so we have been working on a number of issues like that, as well as the information that Roger Gantz was able to share with you tonight about bills that can forward the action of the Health Benefit Exchange and the Office of the Insurance Commissioner and the Attorney General to give them more power are so important in that gold standard that we're looking for.
Thank you, Ronnie. A couple other questions here. In terms of our efforts in Washington State, we know coordination is very important. We have a question here from Beata around, are there other coordination efforts with other states like Massachusetts, California, Oregon, Arkansas, others? That's one part. And then a related question from Eric and Melissa. Is there a cohesive roadmap for what we're doing to achieve universal health care in Washington? And then what's happening federally? Because there's so many moving parts. So kind of two related questions there.
Marcia, do you want to take the work with other states?
I will be happy to. Yes,
states?
yes. I was going to jump in and say, yes, we work with this group called One Payer States. We're one of the early members of that group before they even had Zoom capabilities. And we used to have conference calls with them. So there are about 20 other states, and they range from California, Oregon, Colorado, New York, Pennsylvania, Maine. I see Hank is here on the call tonight. And Minnesota is included, and there are more than that. Those are just a few of the highlights. And you can go to their website, onepayerstates.com, just all the words strung together, and you can find out more about them. And they have Tuesday night sessions, educational Zooms, and third Friday mornings, educational Zooms. So it's definitely worth checking them out to see where we are, and we're a solid member of that group. So thank you for your question.
And I think the other part is, while those things are moving forward, the federal government problems are moving the other way and creating a lot of creating barriers in there and limiting the access and the funding of care within our state. So we have two trains going in opposite direction. You remember the math problem as a child. If one train is going X number of miles per hour from Washington, D.C., and another train is going at a certain speed from Olympia, Washington, when are they going to meet? And so there is a lot of effort, and the bills that Roger highlighted tonight are some of the bills that can help find some solutions there. We've got a lot of work ahead of us. And the universal healthcare pathway that we've tried to develop was certainly was history of where we've been, but we also are looking at the next steps. And we want you to participate. We need you to participate to help us define those. We have some wonderful advocacy groups in our state, and we have national groups. Marcia mentioned One Payer States, but Physicians for a National Health Program that David McClanahan introduced us to in the beginning of this hour, is doing some phenomenal work nationally and leading us to some wonderful programs that can make a difference.
And now you can help too. So why don't we discuss those volunteer opportunities? Can you show that slide? Ronnie, please.
Yes,
So,
I can.
thank you.
I can show that slide. I just have to.
Thank you. So this is a section we like to call "Teamwork Makes the Dream Work," and so we call on you to join one of our teams. We have are you, for example, do you belong to groups that want to hear more about what we do? Or you can organize speaking events at your legislative district, local business, church, or club. And do you like to write? You can create and edit content for our flyers and educational materials and create graphics and video for our website and social media channels. Excuse me, I'm getting to the right page. Do you enjoy policy? Monitor and participate in the Universal Healthcare Commission and other boards or commissions that Ronnie just mentioned. And you can also meet with legislators together with us and advocate for legislation that builds the foundation that we were just speaking of for universal healthcare in Washington state. Maybe you're good with numbers. You could help us produce surveys, conduct financial analyses to develop fiscal policy and recommendations for legislative efforts, or help with legal compliance, disclosures, and governance tasks. Or maybe you like to plan events like house parties or larger local events. Our treasurer, Dr. Peter Lucas, will tell you more now.
Okay, can you all hear me?
He can see you too. Thank you.
Wow. So I want to thank this esteemed panel for bringing us up to date on proposed and active legislation. As many of you know, Healthcare for All has supported legislative action since we were established in 1994, including the Washington Health Security Trust, which is a bill that we wrote to create a single-payer system in our state. And we helped create the Universal Healthcare Commission and continue to be active participants in its mission to establish a proposal for universal healthcare in our state, and we strongly advocate for it to be a single-payer plan. And we are quite pleased that more folks are offering to volunteer for our organization. There are many opportunities within Healthcare for All Washington, which were just mentioned. And if you can volunteer, you can make a difference developing legislation, education, outreach, and development activities, which include recruiting more supporters and fundraising. I certainly like some help with the latter. Our professional lobbyist, Lonnie Johns Brown, as well as our board members, volunteers, supporters, and communications specialists maintain close contact with legislators, providing education and guidance in drafting bills and enlisting allies in Olympia. We have been involved in the creation and enactment of many progressive healthcare reforms over the years and continue to do that work. And we are very fortunate to have forged strong bonds with many Washington state legislators who support our mission and work to bring it to fruition. And unfortunately, or fortunately, our lobbyists and communications specialists don't work for free. Our donors provide the financial support for them and other activities, for instance, these monthly webinars. So please help us continue this work by making a donation tonight. And there's links to donate in the chat. Together, we can achieve cost-effective, high-quality universal healthcare coverage in Washington state. So that's enough. Thank you so much.
Thank you, Peter. That was great. So I think we're just about ready to wrap up. Do we have time for a question that we missed, or Mohit?
Well, let's go back to Mohit. But first, just if we could let people know that in March, our second Wednesday speaker series will not be on the second Wednesday. We will be collaborating with Physicians for a National Health Program, and we will be bringing in some members from the Somali community, the Somali Health Board, and physicians that are in community practice from the Somali population, and even some pharmacies, a couple of pharmacies that have opened up in South Seattle, as some examples that despite what our president has said, the Somali population has been a critical part of our community. So Physicians for a National Health Program and Healthcare for All Washington will be combining in March. That'll be on the third Wednesday. And we are looking forward to supporting and learning about our Somali community. So now there's like a lot of questions here. So Mohit, can we turn it back over to you to lead us with a few more questions?
Yeah, in the chat we covered quite a few. I think if there's others, I'd invite folks to unmute and ask your questions. We had a good one from Maria in the chat. It's worth kind of articulating out loud too. Is it more effective to send a pre-formatted email or compose one of your own? And I was sharing that it's absolutely more effective to share a personalized note. I think legislators listen. They hear a lot from advocates like us who do this, routinely, but when you're able to share something that relates to yourself and shares a personal anecdote, it makes the issue more personal. And definitely goes a much further way. The pre-formatted templates are a great way to get started, but you should adapt them and build them for yourself. And we're here to help with that too. Other questions from folks?
Maybe raise your hand if you have a question too.
Oh, yep. Roger, I see your hand up again. Go for it.
Yeah. So if I could just add to your recommendation, what also is helpful, particularly if there's a bill in a committee, obviously sending it to the committee itself, but if your legislator in your district is on that committee, I think a note to him or her carries additional weight because obviously you're a member of their district and they represent you. So that strategy is also very useful as we're trying to endorse and support various pieces of legislation.
Thank you, Roger.
Marcia, you've done a great job at organizing us and helping us meet these new volunteers from North Seattle Progressives. Maybe call out a thank you to that community for making this happen tonight. So thank you all.
Yes, thank you everybody for joining us. You really you made it happen. All the new volunteers, and we hope to work with you soon. We'll be in touch with you or send us any questions you might think of, and we'll be happy to work with you. So we can say good night and thank you very much to everyone, and see you on March 18th, if not before.
Good night, everyone. Thank you.
Good night.
Thank you.
Thank you.